So lipedema is a very under-recognized condition, unfortunately, not only in the US, but pretty much around the world, for really no good reason. It was identified at the Mayo Clinic in 1940 in a very good paper about it, but we didn't learn about it in medical school. Most doctors don't know about it. Most people don't know about it. Insurance companies continue to ignore it. I actually think had it been given a different name other than lipedema, which sounds too much like lymphedema, we might have been taught about it in medical school. It is one of several different fat storage conditions that we do learn about in medicine, such as Derkham's disease, adipocyst dolorosa, Madelung's disease. This one, lipedema, presents usually in puberty or the teenage years. It tends to get worse as time goes on, either very slowly in most people, or sometimes there's increases in activity of the condition more rapidly with hormonal changes, pregnancy, menopause, OBGYN surgery. It commonly runs in families. We believe it's what's called autosomal dominant inheritance pattern. So usually you can find a family history of lipedema that goes on. There is a typical look, as you probably know, to the lipedema patients. There's different stages of lipedema, stage 1, 2, 3, 4. There's different types of lipedema. In the common type of lipedema, I believe it's type 3B, you get a column-like look to the legs all the way down, where the fat has really encircled the leg from the ankle to the groin area, the upper thigh all the way around. In those patients, most of them have involvement in the upper arm areas. Sometimes it becomes even involved in the forearm area. The upper buttock areas many times is involved. You have a lot of symptoms that go along with lipedema besides the fat overgrowth. You have pain as a common occurrence with lipedema in most patients. Sometimes it's severe, sometimes it's very, very little pain. Swelling is another common symptoms with lipedema. And in some people, the swelling goes up and down very readily. In some people, it's very, very stable. You have easy bruisability that goes along with it too. I actually feel, and we'll talk about what causes lipedema. At the present time, we don't exactly know, but it does seem to be an interplay between not only the fat tissue itself, but the lymphatics. And it may be that the lymphatics themselves are the primary process, because more recent studies have shown that in lipedema patients, there's an increased permeability in the wall of the lymphatics, and you're getting cells, what are called stem cells, migrating into the surrounding tissues, developing into mature fat cells, which then start replicating. You get inflammation to those replicating cells, you get swelling, and you get this fibrotic, almost scar-like reaction going on in the tissues as time goes on. You also have other types of things that point to a common denominator. Patients have easy bruisability, so there's a fragility of what's lining the blood vessels and capillaries. Many patients have leaky gut syndrome, and there's a common coexistence of something called Ehlers-Danlos syndrome, which is a connective tissue disorder that can cause hypermobile joints and increased mobility of the skin. And that's why I think it eventually will be found that lipedema may actually be what's called a connective tissue or collagen vascular disorder as its initial problem, and there's a genetic component to that. So it is, as you probably know, very frustrating. Lipedema it tends to just continue to expand and advance despite diet and exercise. In fact, it kind of has a mind of its own and just continues to replicate the fat cells. And when people try to lose weight, or even they do weight loss surgery such as gastric bypass surgery, it many times will not change the lipedema and just continues to progress. Compression therapy absolutely has a role, not only surgically, as we'll talk about, before surgery, after surgery, but has a nice role, an important role in terms of compression in these patients, from compression garments to MLD therapy to compression pumps. Liposuction definitely has a very important role in terms of the treatment of lipedema patients in almost all patients. And we're going to talk about that in detail today.